Okay, it's 9 o'clock. Let's start again, okay? Okay, as I told you before, it may take less than 30 minutes for me to review this, okay? Chapter 6 of your textbook, that's most important chapter, okay? Because it's talking about how to critique research, okay? Chapter 7 is non-research, okay? If you're interested in improving some clinical change, make a clinical change at bedside, you may choose some non-research guideline or protocol. And even in our college library website, you can go evidence-based, that kind of area, okay? But here we are talking about original research, okay? Therefore, when we talk about quantitative, qualitative, we want you to read some original research article, okay? I'm not discouraging you not to read qualitative, but qualitative is difficult. Can you hear me okay?
Yes, Dr. Sowa.
Okay, good. I think I reviewed this already, okay? Therefore, this is the most important page. You should have this for you to fill out your evidence table, okay? We ask at least 5, but if you want to publish, in the past, some people did a good job and they can publish their evidence-based practice paper. I encourage about 10 articles, okay? But you just do 5, then you can improve later and you can publish, okay? Okay, quantitative research, okay? Let's go back to the abstract you read, okay? Or every night, we all in the morning too, okay? We got new data about COVID, right? Last week, 5 million US residents have COVID. Last night, it said 5.5 million people have COVID. If so, looks like almost every day, 100,000 people we are getting new case, okay? How many people are having that one at one point? That's prevalence. That's another quantitative data. We are interested in number. 100,000 people per day. That's the new case incidence, okay? That's example of quantitative study. But there are some people are collecting, okay? They are expert in collecting that kind of data. They have to follow how to collect that kind of data, okay? Let's go back to abstract we read. Whether parenting skill has improved. If so, we should make a questionnaire to measure the parenting skill, okay? Because to make that as number, they should have a scale. We have a pain scale 0 to 10. They have that kind of scale. If your patient has depression, we have depression measurement scale. Therefore, we are interested in number, objective, okay? We have to follow most experimental study, randomized control study. They have a rigorous protocol how to run. Let's say in this hospital, they are running this, and another hospital is going to run, okay? We are going to collect all the data, and we'll have a really good summary of this phenomenon, okay? Therefore, you should have a really scientific, rigorous, objective, but we are interested in number, okay? If I ask, what are the characteristics of COVID-19 patient? You can do many ways. You can say 40% are African American Black, 20% are Hispanic, let's say. Asian, only 10%, like that. You are telling me using that ethnicity, okay? We are explaining about that person who have COVID, but why African American or Hispanic is getting more COVID-19? You are asking why, okay? A little different. Therefore, there may be some relationship between ethnicity and COVID infection rate. We can start thinking about the variable possible, okay? Therefore, you can just describe who are they. You can tell me how old are they, who are they, their ethnicity, their living environment, how many people are living in their household. You can just describe that COVID-19 patient situation. But actually we can give some relationship. Is there a relationship between these two variables like that? Let's say you are working at post-anesthesia unit, okay? Nurse think, I think patient is anxious, therefore they complain more about pain. If so, is there any relationship between patient's anxiety and patient's pain? If so, we are looking at relationship. If you want to measure that, you have to use anxiety scale and pain scale. This is the example of quantitative. Okay, this one, the chapter 6 of your textbook explained really good. Your textbook is not that hard to read, easy to read, but still that when we ask you to rate the level and quality, that's too much for BSN student. You need at least master's, qualitative you need PhD, okay? That's the reason Dr. Hop and I were in the dilemma to choose this book, okay? We may change the research book next year. We don't have to rate that quality and level. It's not even required for master student, okay? Okay, this creativity, we are not explaining any relations, we are just describing about the phenomenon of interest, okay? Any concept. Correlation, I gave you example. Is there any relationship between two variables, at least? Quasi-experimental, usually we are interested in some intervention, okay? Let's say, after I did some distraction method for this patient, before surgery or after surgery, because I use this non-pharmacological method, anxiety level decreased. Because the anxiety level decreased, the patient has less pain. If you have that kind of hypothesis, you can do some kind of experimental. Therefore, my intervention at this point is giving distraction intervention before and after. That's the example of quasi-experimental. But I'm not doing randomly assigned patient. I'm not doing in control setting, okay? If you do that perfectly in control setting, that's experimental. We are going to review this again when I teach you chapter 6 in 3 weeks. I think this is repeating, okay? We are just describing, explore, okay? You want to have some insight of that phenomenon. Okay, if you are correlation, we cannot say anxiety causes depression, but there may be some relationship. Is the relationship strong? If you get 1, that's perfect relationship. Is that relationship about 0.7? Is it about 0.7? 0.7 weak relationship. If you collect data, enter the data, and if the data analysis shows 0.7, there is a weak relationship between anxiety and pain, you can say, okay? That kind of thing, but we cannot say anxiety causes depression, okay? We cannot establish any cause and effect relationship. Quasi, okay? Therefore, I'm encouraging you, when you try to find your topic, yeah, if you want to go through just PICO easily, just if you put experimental study and your topic, mostly it's a quantitative, okay? We cannot do experimental for qualitative study. Therefore, randomized control study, okay? That's they pick up the best experimental study, and they did perfectly in the control setting. But quasi, we don't have that kind of random selection of the participant, okay? We fail to control perfectly. That's quasi, okay? If it's experimental, we did at least manipulation of 1 independent variable, okay? For example, usually we use 1 standardized group and the other one is experimental group. Experimental group is getting intervention. Control group, they don't get anything. They just doing the usual thing, okay? Let's say I'm heart failure educator, okay? You're interested in whether your heart failure education in unit is working. If so, we are going to half of the patient admitted just doing as usual, just nurse. Usually whenever you give medicine or whenever you admit patient, you teach it, okay? That's the standardized group. But nurse navigator visit this patient at the beginning and give several sessions of teaching. And you collect data later who are admitted in 30 days, someone who got standardized education or someone who got nurse navigators education at least 3 times while they are in the hospital. That is example of experimental, but you have to have a really rigorous written protocol. Everybody should follow, okay? Let's say University of Virginia is doing this one, and let's say North Georgia Hospital is doing the same thing, okay? Then we combine. But when we read the analysis result, it is done really rigorously. Follow the protocol, how to run it, how to analyze, how to interpret. That's example of experimental research, okay? Okay, if it's experimental research, we did perfectly control the setting. Even the researcher and patient doesn't know, and we assign patient randomly. Therefore, if we see some result, it happened because of this intervention. It doesn't happen by chance, okay? Therefore, we can say this intervention impacted the result of that outcome. Our outcome was readmission rate decrease, okay? Therefore, we can tell because of this teaching was so effective, less patient was admitted. We can say that in numerically, okay? That's the example that the purpose of experimental research is whether if I give this intervention, whether we can expect this outcome, okay? Therefore, cause and effect relationship is expected, okay? Okay, your chapter 6 is going to explain more. Basic research, they are interested in just truths out there, okay? That's really, we are not interested in any application of any, we are not interested to improve patient outcome or nursing satisfaction or health system saving money. We are not interested in, just we want find truth, that's basic. But most of case nursing research is applied research, okay? I'm not explaining everything because chapter 6 explain really in detail in everyday language. Therefore, this one I got from other research book. Okay, I'm just introducing today, just head start. But when I teach in 3 weeks, you will know about quantitative. And for this semester, for you to just go through PICO and write paper, choosing quantitative research makes sense. But when you choose some rare phenomenon, not much studies done, you may end up with qualitative study. I'll help you to take that qualitative study. Therefore, rigor means we really have a good measurement tool, okay? And you follow all the protocol. Yeah, when you start any study, you should develop several researchers sit down together, and you cannot collect data by yourself. You are going to train someone who is going to collect data. We have to train them, okay, using the train protocol. Therefore, the result is really precise, accurate. Therefore, we can, although let's say I use 100 as sample, but this phenomenon can be applicable to whole US population. If so, you should generalize this finding to whole population, okay? That's the really, if you follow the real rigorous research protocol. Okay, measure, okay? There are many measurement tools available. If you don't have, you have to develop measurement tool. That's PhD, high level. Not everybody take measurement course, okay? Only the one who wants to really develop new tool. That's not every PhD student take. That's the one, okay? But many measurement tools out there, therefore you have to choose perfect one for your study. If you are doing original research, we are not expecting you to do original research, but still it will help you to read some quantitative study, okay? I made one question about sample and population. You have to differentiate. Okay, I'm going to ask Dana Humphrey. Is Dana out there?
Yes.
Okay, can you tell me what's the difference, sample and population?
So the population is everybody that like it affects, and then the sample is the one group that you're looking at.
Because it's almost impossible to study whole US population, right? Good job. Okay, it's impossible. We can get all the data from all the Georgian, right? It's impossible. You have to choose several county and you have to select several area and collect data. And if you really follow rigorous research methodology, we can generalize the data from outcome from this sample to the population. Okay, that's good start, okay? Most people use convenience sample, okay? Whoever is available, okay? Yeah, some people can use someone in your class, okay? If you want practice, but that's not randomized, right? Therefore, some data from convenience sample, we cannot generalize to actual population. Okay. Mrs. Kaiser collect data using your simulation in Athens last year, okay? Here we just did one time, but Athens for master's thesis, okay? The simulation setting is a little control setting, okay? But if you use animal study, okay, to see the effect of the drug, that's lab setting. That's really highly controlled setting, okay? Okay, I talk about research problem is all the most important thing. When you start your PICO, yeah, you should have some problem, some burning question. It bothers you if you cannot answer, okay? When you are going to start clinical next week, okay? Some of them start in 2 weeks, but when you go, whether it's OB or community or mental health or pediatric, it may trigger you some question from nursing point or patient's point or family point, okay? Therefore, you should have some really interesting concept or topic. Okay? Why this phenomenon is happening, okay? That's the starting point, okay? After you have that kind of problem, let's say I'm interested in why my unit has so much, so many catheter related infection. If your unit manager asks you, you have BSN from PMAN, please find out. If so, that's your starting point of a research problem. What's next if you have that kind of loose per person problem? You have to go and find some article first, okay? What is available right now? From there, you are adding some new knowledge, okay? Therefore, we have to start literature review. I talk about this framework. We used to teach about nursing theory. This is hard, but this is a lens to look at problem of your research from whole or process, okay? You start with this and you are going to end up with this. Okay, if it's real original research, they usually start with hypothesis and question in quantitative, not in qualitative, okay? Qualitative, you can approach. Qualitative, I think it'll show up soon, okay? I'll give you some example of qualitative later. Okay, variable, okay? Let's go back to is there any relationship between anxiety level and depression, okay? Let's say, some people say anxiety affects depression? If so, which is dependent variable there? Can you differentiate dependent variable and independent variable? If that's hard, I'm going back, okay? Let's say Angela is interested in one antiviral medicine that effect of antiviral on COVID outcome. If so, which is dependent variable? Angela, can you tell me?
The dependent would be the level of COVID, right? Like the
the outcome, right?
outcome, yeah.
And the medicine, that is independent variable. We are looking at the impact of the medicine, right? On COVID, maybe outcome can be defined in many ways. Length of stay, it can be outcome. The people stay less in terms of length of stay, or people don't die if you use the antiviral like that. That's so many ways we can define outcome, okay? Therefore, you have to know what is dependent variable, independent variable, okay? Okay, you are measuring empathy. That's really abstract variable. That's the reason some PhD people are trying to read all the other science about empathy and they develop tool, okay? But temperature, that's concrete, okay? It will tell you the number, weight, it will tell you the number, okay? Therefore, if you do original research, you have to define what you are telling me, okay? If you're going to use empathy, okay? Nurses' empathy toward COVID-19 patient dying alone. If so, you have to define what it means, empathy, okay? Assumption. This is something of accepted as granted, okay? It is truthful. Most of when you read an article, it will talk about assumption. If you don't know, just skip it. And usually they talk about limitation, okay? Whether they have theoretically it has limitation, okay? Whether methodologically, whether it has any limitation, okay? Therefore, if you can generalize to whole population of interest, in maybe you may have less limitation. Okay, design. This is most important. Therefore, if you are interested to find, by looking at title, you couldn't tell whether it's a qualitative or quantitative. You have to go design section. It will tell you what kind of study they are using, okay? Okay, population and sample, this is the most important thing you have to know from this slide, okay? You have to differentiate. There's no way you can study whole population and get the result. Therefore, you are choosing sample, which is bigger.
Population.
Yes, population is bigger, okay? But randomization is almost impossible. Therefore, you usually ask one person and they ask another person, okay? One PhD candidate is bothering me whether I can join her nursing faculty retention. She has been contacting me 1 year. I didn't answer yet because if I join with the problem, I have some problem about nursing faculty satisfaction in general. Therefore, my opinion may be really biased. Although it's a qualitative, I may become outlier. That's why I'm not answering her yet, okay? Okay, measurement. I told you this measurement issue is PhD level, but reliability and validity is really important. Chapter 6 explained really well, okay? Reliability is consistency. Therefore, let's say I can, if I use this one in another hospital, I'll get same result. Validity is where am I measuring the one I want to measure? That's validity, okay? I say I'm going to measure empathy, but I may not measure empathy, okay? I may measure different thing. Sympathy rather than empathy. Therefore, validity is, there are several different validity I'm not going to talk about. Therefore, validity is why are we measuring what we are supposed to measure. That's validity. Reliability, it can be generalizable to other situations because you have a consistency of that too. Consistency of the research protocol. We have to follow what we are supposed to do. That's all you have to know. I'm not asking anything about this. If you differentiate qualitative, quantitative, sample and population, that's enough, okay? Data collection, yeah, you have to follow, okay? Most of the case, they tell you how to follow that procedure. Analysis, this is master level. Most master level student doesn't understand analysis. That's really important because you will go through statistical analysis in quantitative study, okay? When you read, it bothers you because you don't, if you don't understand data analysis, the statistical section, I can help you. But you can skip it. Still, you can critique your article and you can do still evidence-based practice paper, fine, okay? Okay, result, okay? They usually have to go back what they are going to do with objective and hypothesis. They have to go back and answer in visual section if it's good article. Usually at the end, my study has this limitation, strength, and they usually tell, this is the point, we have to improve this one because I couldn't address. Therefore, my sample was too small. Therefore, we cannot generalize this finding to population. They usually talk about that. Therefore, this is really important. When you pick up 5 articles, just look at title first, okay? And read at least abstract. Our college may not have PDF available, but the librarian said you can get it through them in 48 hours, okay? But usually I may just go through what you have. You can get easily. Just, if you say PDF available, just look at that first for your this EBP project, okay? But if you don't get 5, you don't like it, you really want some article you don't have, you have to ask interlibrary loan, okay? Therefore, look at abstract first, then go discussion session, that's the way. But for you to talk about whether it's a qualitative, quantitative, you have to go method section, okay? Therefore, if you read abstract section, it talk about everything already, introduction, method, result, discussion, reference. Therefore, by just reading abstract section of the method section, you can tell whether it's quantitative or qualitative. Okay, scheme of research. You cannot read thoroughly. Let's say you chose first 2 articles. You have to give me first 2 articles and PICO in 3 weeks after Dr. Hub teach you about PICO in 2 weeks. If so, you cannot read everything. Just what's the best way? Look at abstract, read it, title, abstract, then introduction, and discussion. Usually scheme, we don't expect you read everything. Then if you really like the article, you can print and use that as one of your articles. Okay, some usually good articles that they didn't have any financial conflict. Let's say it is pharmacological study. They didn't get any money from the pharmaceutical company. They usually have talk about where's the funding resource. Okay, it should be clear. Okay, they talk about they are expert about that field. Okay. The chapter 6 of your book is really good. This is from other textbook, but yeah. When they talk about problem, when they have a question, they have to answer the question in the research section, and they should discuss about that in discussion section again. Therefore, you have to go through this, okay? Yes, I think when you write your evidence-based protest, you have to write really logically. Introduction should be there. You have to always talk about problem, okay, why you chose that topic. And you have to talk about PICO, or how you develop that PICO, how you chose that 5 article, and you have to talk about critique about the appraisal of the 5 article, and you are summarizing what you find. Therefore, you have to answer your PICO question after you read 5 articles. Same thing. Did they actually go back and answer everything we need? Okay. Therefore, after you are done everything, you have to communicate. The way you are communicating is right now. This semester, you are giving us a table, and you are going to write paper, and you are going to present. Okay, that's the way you are communicating. Next semester, you are using same thing, and you are going to make a poster. Therefore, next semester will be really easy for you. Okay, therefore, that's the way you are communicating your finding. Okay, searching for evidence. Today, I'll be done in 10 minutes, and if someone wants to stay with me, I'll stay with you and start thinking about your topic, okay? The best one, go online, Piedmont College online, choose online, then start from nursing engine, the CNAR first, okay? And if you are interested, just population, pediatric or OB, just put that pregnant woman. That's your interesting population. It's a pregnant woman. And what topic? Okay? You can relate that COVID to, okay? Delivering in COVID, okay? That kind of experience. If so, you may have only qualitative, okay? If that's your burning question, choose it, okay? But it may be hard for you to criticize. Okay, PICO. We are starting PICO today. You learn about this in fundamental. You will have some question about PICO in your quiz, first one, okay? What is P? Tell me.
Population.
Yeah, population of interest, okay? It doesn't have to be patient. If you are interested in nursing, nurses satisfaction, population is nurses, right? And nurses, you can narrow down someone who is working at palliative care unit, someone who is working at IC unit. You can narrow down your population of interest because they are suffering. That's the reason you think person who works at emergency room, ICU, or palliative care unit, their retention is bad because of that nursing burnout. If so, population you have to narrow down. It should be nurse, it's not patient, okay? Someone talk about adolescent already, Lisa talk about. If so, you have to choose adolescent. Pregnant woman, you have to tell me. What is I?
Intervention.
Intervention, okay. It could be anything. It doesn't have to be teaching intervention. It could be pharmacology versus non-pharmacology, right? That's easy, okay? Therefore, everyone can choose teaching intervention. If you choose one condition, that's easy way you can finish. But you want to answer something. When you go clinical next week, try to find some question, okay? Then try to choose some intervention. Or if you choose only one intervention, nothing is done. If so, just the comparison section, you can say nothing is available, not available. But still, if you choose one, you can put the other one, opposite one, okay, as a compared. Comparison is usually outcome, okay? Patient die or not die, that's the outcome, mortality outcome, okay? Patient satisfaction or dissatisfaction, that's comparison. Or intervention, you can put one group in standardized group, one group in that intervention group, that's the comparison section. What is outcome? Depend on variable of your study, okay? Study of interest, okay? Whether it's a nursing retention or nursing satisfaction, patient's mortality or anything you are looking at, okay? That's outcome, okay? Therefore, you can start some topic today, okay? I'm moving to qualitative. I talk about qualitative already using my capstone. Therefore, you may be almost ready. Therefore, it's a subjective. Objective was quantitative. This is subjective because I'm interested in the phenomenon. I'm interested in getting some insight about the phenomenon. So it should be systemic too, okay? But we are interested in the words, okay? It doesn't have to be words. Some qualitative study, they ask patient, the participant draw image. one question was the parents who has children with autism, okay? They asked them to draw some picture of your life course after you have the baby with autism, they are growing. And ask them to draw, they analyze the image, okay? Therefore, it could be anything. If you are a historian, go to library and read all the old historical data. That's qualitative too, okay? I told you, I review the medical record, okay? Electronic medical record. It could be qualitative data, okay? It's not directly related to number, okay? It's a subjective. I'm going to talk about this, and I may stop here because we are going to learn more detail how to do when I teach you chapter 6, okay? Phenomenological. Dr. Anderson's study was phenomenological. Someone who has trauma, sexually attacked in Africa, and that woman's baby were adopted by American, and she interviewed that parents who adopted, and that's the life experience of that relation. I didn't read it yet. I asked her to send me abstract. She didn't send me yet. Ground theory, I talked to you already. We are interested in specific phenomena. Our goal is to develop some theory. Ethnography, let's go Mexico or Guatemala or Middle East, and you are observing that culture. It doesn't have to be an actual geographical one. You can see that 9 nurses at pediatric ICU, okay? You want to observe their behavior, okay? If that's another culture, okay? And it could be exploratory. We are not interested in any causal effect relationship. We are trying to describe, and I talk about the historical qualitative already, okay? I think I'm going to stop here and stop share. Do you have any question? I'm not recording anymore. From now, I'm going to spend time to help you developing PICO question, okay? Do you have any question to me?
Dr. Sowa, this is Mark. So I just have one clarifying question. Just one.
Yes.
So qualitative is subjective and quantitative is objective. Is that correct?
Yes, and subjective, you're interested, we are explaining the using number, right?
Numbers. Okay.
Yeah, number. Qualitative, we are more interested in words, narrative, how they tell you, okay? More words, narrative statement. But I told you it doesn't have to be narrative. It could be, we can get some images, we can get historical data, but we are not interested in number. Is there any strong relationship between these two variables in terms of number? That is quantitative. But in qualitative, we are never going to ask that, right?
Thank you so much, Dr. Sowa.
Okay, therefore I'm stopping recording this section, okay? And both Essence student and Demora students stay here today to, if you want to start developing topic today, okay? Are you okay?
Yes.
Okay.
Dr. So I have a question whenever you're
Yes.
able to answer about my topic in the PICO
Yeah, if
format.
so, I'm not recording. Therefore, I'll invite you again, everybody who wants to stay, because I don't want to record this. Okay, I'm going to stop recording right now. Okay, I'll invite everybody again for talking about topic. Okay, good job. You did good job. You got good foundation. You can start PICO. Okay, the earlier develop, the better. Okay, don't wait 2 weeks. Okay. And this week you don't have any tests. You have time to look at some article, okay? I can help you. You don't know how to find the article, okay? I'm going to stop recording.